I want to go over PE, pulmonary embolism. I actually had this experience last week and had to send a resident out to the hospital via 911 because she was in some serious distress, and I picked up on the symptoms, so I thought I would come on here and explain signs and symptoms of pulmonary embolism and how it will be diagnosed and treated. First, if you walk in your patient's room and they are having shortness of breath, clenching their chest or their throat, they have visible neck distension, I want you to think PE. First thing you're going to do is, if you suspect PE, you're going to have that patient sit up in a high Fowler's position to take some of the pressure off the lungs, to administer some oxygen either via nasocannula or mask. And you are going to want to get a quick set of vitals: blood pressure, the respiratory rate, the heart rate, and the pulse ox. You're also going to want to assess for the chest pain. You're to assess for cyanosis by looking at the fingernails. Are they blue? Are they purple? Are they discolored? And also, patients with PE can actually be coughing up blood, and that is something I actually noticed with this patient a few days prior. So after I got all her vitals, I rushed to call the provider. Also called 911 to get her out of the facility and get her to the ER. This is a medical emergency, so you need to act fast. At the hospital, they will do a CT pulmonary angiogram. So they're going to get blood work done, and they're going to be looking at the D-dimer, troponin, and the ABGs, the arterial blood gases. Most likely, they will be diagnosed with an antiplatelet or antithrombolytic medication IV route. Patients are going to be very anxious, so make sure that you are staying bedside with them and reassuring them that things are being done to find out what is wrong and how it's going to be treated. A lot of people have not experienced PE before. This is scary for them. And PE happens a lot more than it often goes undiagnosed by some nurses. Make sure that you can recognize the signs, you know the signs and symptoms, and you know what to do and how to treat them immediately, so this is not life-threatening. Hope this helps. Grab my farm study sheets if you want. They are an amazing study tool if you need it. I wish I had them when I was studying. Happy studying and have a great day.